Good night. Next news. Artist Jackie Ferrara ends her life through medical aid in dying despite being in good health. PLE. The 95-year-old sculptor traveled to Switzerland to end her life on October 22. Below are your comments. As a 3-time cancer survivor with numerous medical difficulties, it saddens me that dogs are put down by people and people can't make their own decisions to end their suffering. She made a personal decision that is none of anyone else's business. As a veterinarian, I find it appalling that we are able to end the suffering of animals on a daily basis, but the law prevents the same act of mercy for human beings in most states. It's simply barbaric. I'm not sure what I think. But I have an aunt who is 102 years old. She needs round-the-clock care. I don't think I'd want to go on living in that state. I'm honestly conflicted about how I feel about this for me personally. I watched my dad suffer and die without dignity last year, very aggressive NHL. The consequences of this sort of death are so horrific that maybe going out while you're still in okay. shape makes sense. And I also said goodbye to an almost 18-year-old dog last year and I had to make the choice to let her go because the evidence suggested she was suffering. And I think that was a gift to her. People's life, their choice. Life is a terminal condition. We didn't get a choice whether to be born or not and what circumstances we'd be born into. Once we've reached adulthood, we should all have the option to choose to die quickly, painlessly, and with dignity when we decide we've had enough. I'm old now. I am aware of many people who are contemplating how to DIY with the least amount of trauma for everyone involved. Having a humane way to exit would be a blessing. Here in the USA we extend life because it's amazingly expensive. Our elderly are a cash cow and there is no way the medicals establishment would allow individuals to make decisions that would save us billions. If I could afford to travel to Switzerland, I would definitely do it. I've already told my family that if the time comes where I have to move into an assisted living facility, I will instead find someone in the hood to sell me a lethal dose of fentanyl. Preferably the veterinary variety, which is much stronger and quicker. I don't want to have people changing my diapers and being fed through tubes. I want only independent living and I am secular. I am 80 years old and want to do the same thing, but traveling to Europe is too expensive for me. The Catholic Church, which watched as hundreds of children were known to be abused by their clergy, should have no say in this. Our country does not provide dignity in death. This makes me feel a few different feelings. The thought of ending my life while I'm healthy seems odd, but the knowledge that at age 95 anything can happen at any time that could take that choice away from me makes me completely understand. Her body, her life, her choice. If you don't like how it makes you feel, that's completely fine, but it doesn't give you a right to tell anyone else how to live or die. They decided while they were still able to travel from the United States to another country, check into a hotel, etc. Many people might want that but are too sick to do it at the end. I hope to end mine the same way, but our country offers no dignity, no healthcare and no plan. End of life is so hard no matter how you go. Forcing the elderly to endure worry and fear about when and how they might go is crueler than letting them decide. Yes, it's sad, but there are no happy endings. I respect her decision and believe we should have that option here in the USA. I wrote my undergrad paper on the support for medical aid dying, and I am thankful for places in Switzerland that are available. Why rot in an old people's home when you can go out with dignity? She went on her own terms. There is courage and grace in that. I find it insane that in the US we show animals the kindness of ending their suffering but deny that to people. Let people make their own decision about when it's time to move into the next realm. Interesting that from the time we could take control of our own lives, there's still condemnation and we choose to end it. My wife is a hospice nurse, and she's served as bartender mixing people's last drink here where it's legal in California. You would be surprised at the number of people who make the decision for non-medical reasons, while getting their doc to sign off on the medical basis. But reasons very important to them. Somebody's lived their whole life, they should be able to decide how they want to go, you don't judge. You just respect it, and how awesome life is. Life should be defined by quality, not length. Our advancements in medicine can prolong the semblance of life long past the time of death. Why do we force those in pain, in total dementia with loss of all cognizance, with no unassisted bodily functions to continue to suffer? There is mercy in letting go. I'll never judge someone of sound mind to see themselves off as they chose. Especially the elderly or ill ones who want to avoid the agony and suffering of their impending say. Rip Ma'am Red Heart. She made the choice of her own free will at 95. Rip. I respect that. I may change my mind, but it's part of my plan too. I don't have kids, I do have money. Not all that expensive in any case. And somewhere around 90 if I make it that long. Earlier in face of debilitating illness. I'd just as soon go before I become property of caregivers, hoping I get my mush on time. The trick is you've got to be healthy enough to travel, and of course it assumes mental competency. But the genetics are pretty good on that front. People should have the right to go out like this if they want. Who wants to suffer and linger for years? We do it for our pets, why not do it for us? She lived a good, long life and she was ready. Good for her to pass with dignity. Fine. She died of her own choice and with her personal dignity intact. It is a choice that I think is acceptable and a personal, not a state or federal decision. The older I get, the more practical I become about the cost of healthcare. I would much rather leave money to my daughter and make her life a bit easier than to spend that money to keep me alive and in a state of suffering. This is a wonderful story. They need this legal in USA. I lost parent and a grandparent to dementia. If it's heredity, I will take myself out. I refuse to linger in a nursing home while the doctors and facility drain the family's resources. No. Wing what the end will be. Please subscribe to my channel. And if you like it, please thumbs up.